Hello, hello. My name is Jess, and this is Patient POV. You can find me on Instagram at Jess underscore and underscore Elda. So that's ELDA. And before we jump in, something I always forget to say is the notes on this conversation, as of every podcast episode I've posted so far, the notes recapping what we've discussed is in the description, yeah. And there is also links to any recommendations whoever I'm talking to has mentioned. I try to add the links there as well, even directly to Amazon if there's a product there that they recommended. So I wanted to say that before we jump in. I always forget. So this week has been good. I in particular went to the paramedic headquarters here locally, and it was an event for service dog and trainers with their team. And so I'll be posting some pictures about that very soon. But Elda and I went, and Elda did so well. So Elda is training to be a service dog, and she did so well with the other dogs that were around, as well as seeing a bunch of people with the loud noises. If anything were to ever happen, we wanted to be prepared. So we practiced loading in an ambulance and how she would do that. And then it was also education for the paramedics to be able to understand that service dogs are not just for somebody who was blind as a guide dog or other things like that. So it was really, really fun, and she did really well. I was really anxious going into it because I hadn't trained with her in almost a month because of getting spayed, and then just everything. She had an allergy reaction as well. So we had taken a break from that for a while. And so it was great to see that she's doing well again, and we'll kick back up the training in full gear here. And the next thing she'll start working higher intensity on is the actual alerting to a high heart rate. So that's going to be super fun to try to scent detect train for her. So that's a little dog update that I try to do every week. But yeah, and then I've also been watching Friends, as I started it before Matthew Perry passed, but now that he has, I figured we gotta finish it for sure. So that's what I've been watching as well on TV. So I'm very excited for you to hear from Kisha. She is a public health nurse, but she also has POTS herself. And so this is a relatively new diagnosis. And so she is also a mom. And so it's very fun to hear from somebody who has a hand in so many different sides of life. And so I'm really excited for you to hear from her as well. So thank you so much. And I hope you guys all have a great week ahead. Thanks. So hello, hello. How are you today?
I'm doing well. I hope the same for you.
Thank you. Thank you. So do you want to start just by introducing yourself and telling us a little bit about your background and your health journey?
All right. So my name is Lakeisha. And as far as background, what type of information are you looking for?
So what has your health journey been like? With I know
Okay.
you mentioned you have POTS, and so kind of what was your journey there like?
Okay. So my journey with POTS has definitely been very, I don't want to say difficult, but it's been a different experience. For me, it started out with some cardiac issues that was concerning. So I started seeing a cardiologist and he couldn't figure out what was going on. Which landed me into the hospital for some ER visits, anywhere from, I want to say, 10 to 20 visits within like a 40, 50-day period. Um, and they couldn't figure out what was wrong with me. And at the time, I actually worked at one of the hospitals that I was seen in, and I was treated horribly. And the nurses actually came in and was talking to the doctor, like, she works here. She's our infection preventionist. I think you better change your tune a bit. So then he kind of changed his tune a bit, but they still really couldn't tell me what was going on. So eventually I went back to my primary care physician and I told him, every time I go to the ER, they're telling me I have anxiety. And he's like, I doubt if you have anxiety, but I'm gonna put you on some boost par. And if this doesn't handle what's going on, it's not anxiety. So he put me on the boost par. It didn't take care of anything. So he's like, I'm taking you off the boost par and I'm gonna run some tests. But meanwhile, let's get you to see some a cardiac specialist. And I'm like, I'm already seeing a cardiac specialist. So what's the next step? So when I saw my cardiac specialist, he's like, I want you to see an electrophysiologist because you might have some micro tears in your heart, in the valves or in the veins or whatever he said in my heart. And I'm like, okay. And he's like, yeah, we're going to go in. We're going to put you under. We want to go in with a small catheter through, and I'm like, I'm not doing it. I'm not doing anything with you putting no catheter into my heart. So finally, I'm like, let me just Google what's going on with me. So I Googled all my symptoms and then POTS came up. And I'm like, this sounds like something that I'm experiencing. So I finally went to him and I'm like, can you just test me for this POTS thing? And lo and behold, I did the tilt table test. I couldn't even finish the whole test. The doctor stopped me. He's like, we're not even going to let you finish. You basically have this, and we want you to increase your water, take salt, small meals, and we'll follow back up with you for an appointment. So I waited around for like a month or so. Nobody ever called me back. So finally, I got frustrated and I just Googled pot specialists in my area. And I came up with this doctor, Nicholas DePachi, and I called him. And the office was like, okay, yeah, we can get you in. Now, here we are. This is April. They're like, we can get you in August. I'm like, August? So from April to August, I'll be suffering. But so I managed myself from until I got there in August. And then from there, everything just went well from August on.
Nice. Nice. Yeah. And so we're talking about August, what year?
This was 2021.
2021. Okay. So within the last little while.
Yes, my symptoms actually started in 2020,
Okay.
but I officially diagnosed until April of 2021 when I went to the hospital to have the tilt table test done. And then August of 2021 is when I was officially started to be treated by a specialist for the POTS.
Okay, good to know. Good to know to have some frame of context. And then a little bit about yourself in terms of where in the world do you live?
I live in New Jersey, southern New Jersey to be exact. Which when I first started looking for a pot specialist, the first place that came up was Texas. And I'm like, oh my gosh, I can't be treated in Texas. I'm going to have to fly all the way to Texas. But the website, I forget the lady's name, but she has a lot of information on her website. She was really good. And she also stated on her website that if you live in a different state or county or whatever, that she works with your primary care physician. So she'll tell your primary care all the things she wants you to do and be on, and they'll write your primary can write the scripts. So I was like, okay, maybe I can do that. But I did end up finding somebody in New Jersey, so I didn't have to go for it with the Texas person.
Yeah, no, that's a really cool way of doing it though. The you can be treated no matter where you live in the US.
Yeah,
Yeah.
exactly.
Yeah, no, that's really cool. And then a question I ask all my guests that come on, which I'm trying to remember to do every time, is are there any TV shows, movies, or books that you're reading or watching right now?
So I'm watching nothing to do with my condition. What am I
No problem.
watching? I usually catch it on TikTok and not on TV. It's a stupid show too. Um, oh my gosh, what's the name of it? Sisters.
Oh,
Um, I watched a show called Sisters. It's trash TV basically about relationships and men cheating and people getting married. So that's what I'm into right now at this moment.
yeah, no, I haven't had a single person say they're watching something about their condition. Everybody's something different. I'm like, yes, that's what we're looking for. Recommendations that are not about our condition. Yeah, no,
So
that's awesome. Okay, Sisters, I'll have to look it up. I haven't heard of that before.
yeah, it comes on BET Plus, I think.
Okay. Okay, good to know. Good to know. So my question for you is, what have some of your challenges with getting diagnosed, with being diagnosed, with POTS in general? What are some challenges that you feel like you've run into?
So the biggest challenge is being able to manage yourself and still continue with your daily life
Mm,
routines, working or managing your home, taking care of the children. Because for me, everything I do, believe it or not, I have to rest in between
mm,
because the fatigue is so bad that, if I sweep my floor, I only can sweep half and then I have to sit down and rest for like 30 minutes to get back up to do the rest. So just imagine a full work day is very stressful. It's stressful on the body, it's stressful on your mental. So being able to actually manage yourself and take everything as a step process, like you really need to plan your day out
mm,
and you really need to be intentional um, on what you're doing that day. So sometimes everything might be, all work and no play, as I like to say, but you still have to find that time to sit down and relax, to let your body kind of reset itself. So every day is different, but every day is hard.
mm, mm. Yeah, for sure. And so, I know you say every day is different. Do you have a kind of a day in the life? What would that somewhat look like for you?
Um, so I get up in the morning, I do my AM care. That takes me maybe an hour to 2 hours just because I need the rest breaks in between. Then I have to work from 8:30 to about 5 p.m.
Mm,
Um, but in reality, I'm just going to be honest. For me, I usually don't get to work till about 10 o'clock
mm,
because it just takes me that long to get myself together. Plus, it's an hour drive into the office from my house.
mm,
And just if you have POTS or dysautonomia, anything like that, a long drive takes your energy too.
yeah.
So that 1 hour ride from my house to my job is like brutal. So by the time I get into work, I have to reset. I have to, kind of woosah, bring myself down and then get into my work day. So once the workday is done, I come home. I'm dealing with the children. I have eight, but most of them are, thank God, adults now. So I have about three, four little ones at home. Well, not little, high school to elementary school age. So of course we're dealing with homework and cooking and cleaning. And again, the physical you can kind of get over, like the physical tiredness. It's that mental
Mm,
that is hard to get over. Once you're mentally exhausted or mentally drained, it's hard to recuperate from that. It takes a
mm,
while.
yeah, I know for sure. Now, you are the first person on the that I've had as a guest that had children. So, how has managing being a mom as well as managing your chronic health conditions, has that been?
So, the crazy part about all of this is when I first became sick, before I even saw the specialist, I was seeing a therapist because my mom was like, "You must have too much on your plate, and this is what's causing you to have these conditions." So the therapist was saying, it sounds like once your life started slowing down, that's when your illness started kicking in. So
Mm,
she and it probably was always there. It's just that you were so busy, you didn't even have time to address the issues that were going on with your own self because I always had chronic migraine.
mm,
I was getting fatigued a lot all the time for years. I had chronic migraine since I was a teenager.
oh,
Um, I've been fatigued for years. The newer symptoms like the tachycardia where my heart rate will go up to like 200, that was new. And those adrenaline surges where you could just be sitting down and all of a sudden you get this shot of adrenaline and then your heart just takes off. So she was saying it's because, I started settling down and now my
mm,
body reacting. So managing the home with the children is hard and trying to explain to the children that you have this chronic condition that will never go away. Like this is what I'm going to be like for the rest of my life, unfortunately. and they just don't get it.
Mm,
And that was one of the reasons why I started my Instagram page, to try to get people to understand, like, this is what this condition is. And for a lot of us, it doesn't go away. For me, I was hoping it was just something that would be temporary, but according to my specialist, he said mine is permanent.
mm.
So, and my
Yeah.
kids still don't understand. So, eh,
How has your we were talking about your therapist, that you had been going to a therapist, and that that kind of got brought into the chronic health conditions. How has your mental health been now that you have been diagnosed with a chronic health condition, and how have you been able to cope with things?
it's a bit of a struggle because there's no cure. You basically just treat the symptoms. So as far as mental health, if you don't have a strong support system, it'll be a huge struggle.
Mm,
Um, Therapy is very helpful, but also having some coping mechanisms, as you said, of your own. Like for me, I love to be in complete silence. That helps me. I have to have peace and quiet. I also like to read the Bible. That helps me as well. And another thing that I like that helps is, I think it's called the Calm app.
mhm,
I like to listen to like brown noise or green noise. That's helpful as well. Because yes, it can be mentally straining when you have a chronic condition that's never going to go away. Especially if you're not familiar with how POTS works. Because in the beginning, when I wasn't so familiar, I remember waking up one day and feeling like my old normal self. So I'm like, yes, it has passed. I'm done. It's over. And then I did everything I normally would do. And the next day, I couldn't even get out the bed. So, and that can be very hard mentally when you think you're cured. And then the next day, you're just like back to your old sick self. So, definitely having a solid support system. Journaling, oh my gosh, journaling is very helpful. Just write any and everything down that's on your mind. It doesn't even have to make sense. Just whatever's in your mind or whatever comes to mind, write it all down, because it does take the load off of your brain. And it allows you that time to kind of like rationalize and think rationally, as opposed to when you're in the midst of like a pop, you're having brain fog, which is very debilitating.
mhm, mhm. Yeah, for sure. And so when you journal, do you do it based on prompts or just whatever comes to your mind?
Whatever comes to my mind. Yeah,
Mm,
whatever. If I'm having an issue that day, or if I'm happy that day, or even if I can't think of anything, if I'm sitting down, I'll just write stuff down, whatever comes to my mind, because it helps you to relax. And that's basically what you want to do. You want to be relaxed and be calm, even when you're experiencing the symptoms. Because for me, I've come a long way. What I didn't tell you in the beginning is, for a long time, I was bedbound. I had to
mm,
be fed by my husband. I had to be washed by and I was a normal everyday person. I didn't need, I cared for myself. And then for me to become bedbound and have to be washed by somebody, have to be fed by somebody, and I lost like 40 pounds, like I looked bad,
mm,
and I didn't think I was going to recover. But again, I did, thank God. Um, so people who are in the midst of the acute phase of it, you don't think that there's a way out, but there is. There definitely is.
mm. So we were mentioning that your husband is a big part of your support system. How has your support system changed over the time of you having these chronic health conditions?
So in the beginning, my husband is he's not medically inclined at all. So he didn't really think it was an issue. He thought it was something that I will get over in a week or two. So my mom was kind of like my biggest support system in the beginning. She would come down to my house. She would clean the house. She would, make my breakfast and help me with the kids. Because at the time when I first got diagnosed, we were in COVID. So the kids were
Right.
home with homeschool, and I was in the bed, couldn't get up out of the bed. So she was my biggest support system at that time. My husband had to work, so he was at work. Finally, it got to the point where I asked him, I'm like, you just gonna have to quit your job and help me because I'm struggling and I can't. And he understood. So that dynamic changed. My mom went back to her old routine. She would come down here every once in a while, but she wasn't down here every single day like she had been before. And then I started leaning on my husband more for that care.
Yeah, no, so it's always interesting to hear how the dynamic changes, for sure. Um, I don't think we touched on this yet, but you kind of initially had mentioned your journey within the healthcare system and that you went to the ER so many times, but still weren't getting the answers. So, could you explain a little bit about how your health journey in terms of those doctors have been like? Did you experience any medical gaslighting? Did you experience any of some dismissal, and how did that affect you?
Oh, absolutely. Again, I was told, oh, it's probably anxiety. We're going to give you some Ativan. And I'm like, you're not giving me no Ativan. I've never been on any anxiety medications before. So you're not giving me that. And unfortunately, in an emergency department, they're just looking to treat you and get you out the door. They're not there to help you find solutions, so to speak. So me going to the emergency department, working for a healthcare system, I knew heart rate is 200. My blood pressure was 200 over 190, and I'm having a stroke or, I'm going to die. So you go to the emergency room looking for some answers, and they don't really give you any. They just basically give you a band aid for you to
Mm,
make it through to get somewhere to get those answers. So, as far as going to the emergency room for anybody looking for an answer, rarely you will get one. It's just like a band-aid basically. um so yeah, telling me that, oh, maybe you should change your diet, what you eat, that's probably where these symptoms are coming from, or increase your exercise, or things of that nature. And I'm like, I go to the gym every week. I thought this is maybe what started this because I was working out in the gym, and I'm like, oh, I over stimulated my heart, and now I'm having these issues. So I'm like, it's not exercise. It's definitely, and in your brain when something is wrong with your body, and when it's not that. And
mm,
thank God I had a primary care physician who wouldn't accept those answers either.
mm,
Even though he didn't know the answer himself, he wasn't giving up either. He's like, well, we're going to look for something else. Let's do every blood work we can do. He did all types of urine tests. I mean, he's like testing me for everything. So you are your own biggest advocate. Don't accept the answers that the emergency room or the physicians are giving you if you don't feel that, it's the solution to your problem.
yeah, no, for sure, for sure. And then and then the other question would just be, how has your, I know you mentioned you kind of started your social media journey because your kids in particular didn't understand, so you wanted to open that up. And so how has your time with social media, or your reasoning for advocacy, how has that kind of developed over the course of you having a chronic health condition?
So in the beginning, I didn't think it would be as, not saying that it's successful, but I didn't think it would be as big as it is.
Mm,
I just thought, okay, let me go on here and start dialoguing about what I'm going through. And maybe there are some other people who are experiencing the same thing. And lo and behold, it's this whole huge community out here that's dealing with the same issues that I'm dealing with. And I'm like, I only wish that I found this out when, prior to this happening, or when it was happening and not
mm.
after, because that probably would have allayed a lot of my fears and saved me a lot of mental anguish. But I like it. I love it. I get inbox quite frequently from people asking me questions, and I love to be able to point them to resources or help them out or describe my journey. And they're like, oh, yes, I went through the same thing, and so now I know what to do, or there's hope at the end of the tunnel. And I'm like, yes, do not give up. Keep pushing, because there is an answer out there for you. I'm not going to say there's a cure out there, but there's something out there that can help. So at first I was like, my page is for my family, but now I think I'm up to like 8,500 followers. So I'm like, okay, it's getting out there, it's spreading awareness, and, in combination with everybody else who's out there doing things. So I love it.
Yeah, that's really awesome. Another question I forgot to mention while we were on the topic of healthcare system and all that is you're in the States, of course, I believe you mentioned. So how has navigating the American healthcare system been like for you?
I love where I live. I love being here in the United States. I love the freedoms that we have. But even I'm older, I'm not, in my 20s anymore. So I've worked in the healthcare system for over 20 years. So I've seen the changes and the progression. And unfortunately, healthcare system has gone more towards a political or business model instead of what I was used to back when I was younger, which was more family oriented and, more patient specific. I know now they say, we want to be, they claim that they are, patient centered care, but that's not the feeling you get when you go into these places. So I'll kind of wish we can turn back the hands of time and go back to when there was patient centered care, when,
Mm,
you know, I hate to say this, but when some, not all, because I'm a nurse myself, when nurses weren't there just because it's an easy way to make a quick buck, they actually care about the patients and you're here to help someone get better. And I can even remember talking to someone on my Instagram inbox who was saying, how she was mistreated in the healthcare system. And I was just so upset because we take that oath as nurses. We are the patient advocate. Why aren't these nurses fighting more? I get it. These doctors can be brutal, but you take that oath saying that you're going to advocate for your patient, and that's what the expectation should be.
mm,
And out of all those, whatever 20 visits I had to the ED, only one time did a nurse advocate for me. One. And it's kind of upsetting.
mm. Yeah, no, for sure, for sure. And then you also mentioned that you found a doctor within your, you had to find the doctor, first of all. You had to search out for the doctor in particular, and then you were able to call them up, which is kind of cool that you called the specific doctor that you wanted. And then how long did it take for you to get in to see that specialist? Oh, you mentioned, I
4
apologize.
months.
Yeah,
Yep.
you did mention
Yep.
that.
4 months.
Okay,
Yeah.
okay. So that's a long time. It feels like a long time, eh?
It does, yes, especially when you're not being treated properly
Mhm.
for your symptoms. So you're waiting and waiting and waiting. So yes, 4 months.
Yeah, okay. And then once you had that appointment, um, you got like your official diagnosis in the August of 2021. And how did that feel getting the actual diagnosis?
It was a lot of relief to
Mhm.
actually hear someone who believes you
Mm,
because before those prior visits to like the EDs, it was like, yeah, okay. And you just push you to the side. But the doctor that I have, he's like, oh, yeah, this is hallmark symptoms. This is what you have. And everything that I was saying, he's like, oh, yeah, I have something for that. This is what you do for this. So it was like the world was finally being lifted off of my shoulders, and I finally had some answers.
Yeah, no, for sure. I always think that's an interesting thing is a lot of people who are the healthy people just think it's like you want a diagnosis and it's like, but it's the validation and knowing that you can actually get some help is kind of what you're saying as well, eh? Yeah.
Yes.
Yeah, for sure. And then just wondering if you have any resources or and by resources I mean like tools or items or things that you use or listen to that has really helped you with your chronic health condition. I can give you examples if that wasn't properly worded.
So I do read, I think it's the Dysautonomia International Society page a
Hmm.
lot. I Cleveland Clinic, Johns Hopkins, I check on their websites a lot. I did talk briefly about I can't remember the doctor name, but I think her name is Dr. Driscoll in Texas.
Mm.
The place that I had reached out to first seems phenomenal. She has a website, and I think it's called potscare.com. But she has been doing research on this forever, and on her website it says that dysautonomia or POTS, there's 201 symptoms that they look for, and I'm like, darn, is that many symptoms associated with? I
Oh,
didn't even know that.
yeah.
So Dr. Driscoll, her website, I believe is potscare.com. She would be someone good um, to look up. And my doctor, actually, Nicholas DePaci, he actually is a dysautonomia pot sufferer. He's written several books. I haven't
Wow.
bought them, but I do look and follow his website. Um, and I think that what they offer on the websites are just as phenomenal as what probably are inside the books. So if you can't afford to buy the books, at least go to the websites. And Instagram and Facebook are really good resources as well.
Yeah, no, awesome for sure. And finding the community that we were just mentioning before. Yeah.
Absolutely.
Yeah, awesome. And then as somebody with POTS, do you do salt intake? Do you increase salt intake?
So, yeah. Well, right now I'm doing liquid IV.
Liquid IV. Okay, that was going to be my
Liquid
next question.
IV. Yeah. But the nurse practitioner that I've seen said she wants me to try pink Himalayan salt.
Oh,
I'm really not. I have it. I haven't used it yet. I've stuck to the liquid IV. Sometimes I do Gatorade, which I know is not the best. But with the liquid IV, the nurse practitioner was saying it's a lot of sugar in it.
oh, interesting.
Yeah, she was saying there's a lot of sugar in the liquid IV, so try the pink Himalayan salt. But I can say what I've noticed when I don't do the liquid IV and I try something else, I'm not, I can feel the difference. Like the liquid IV works better for me than other alternatives.
Yeah.
So,
Yeah, no. And it's also hard sometimes doing like I call it a salt shot.
yeah,
It's sometimes hard doing that.
absolutely.
Yeah. Yeah, no, for sure. And then my last question for you today would just be what would be some like words of encouragement to somebody who's starting their chronic health journey specifically with POTS? Do you have any words of encouragement for them?
I would say that what you're going through is real.
Mm.
Don't let the doctors make you think that you're making this up all in your head, that you have anxiety or you just need to increase your exercise, because that is not it. You are really experiencing real symptoms. It's a real condition. It's recognized now. Find a physician that's going to back and support you. Make sure that you let them know the total picture of what you're going through so you can be properly diagnosed, but do not give up. I know there were so many times that I just wanted to say, you know what, forget it. I don't even care anymore. It's too much. But keep pushing, because there's a whole community out here who will back you. I will back you. You know, there's a community on Facebook, on Instagram. This is a real condition and it's really debilitating, and you need all the help you can get.
Yeah, awesome. Wonderfully put. Thank you so much. Um so exactly what I was just going to say is thank you so much for being on this podcast with me today. I know it does take a lot of energy and taking away from your busy schedule with all those kids and work. So I do appreciate you taking the time and speaking with me today.
Thank you for having me. I appreciate it anytime.
That's wonderful. Thank you.